let's continue with sign and symptom. Actually, hypertension is the silent killer. Yeah, means no warning sign or symptoms. Yeah, even the blood pressure level are dangerously high. Yeah, yeah. Mostly people cannot feel some sign or symptom. Yeah, but in a small amount of people may experience symptoms such as headache, vomiting, dizziness, and then maybe nosebleeds. Yeah, but just little amount of the people. Yeah, mostly the people cannot feel any sign and symptom, and then the symptom usually do not occur, yeah, until the blood pressure level have reached and severe or life-threatening stage, or maybe some people can know that he or she got hypertension when another disease come, for example, like stroke condition. Yeah, here are some information about the diagnosis. I took this information from the NICE guideline. So many information that we have to concern about the diagnosis, because to diagnose someone got hypertension or no, it's not enough just measure one once a week, or maybe once a day, or maybe uh, 2 times a week. Yeah, not enough from that. So let's see the information about the diagnosis. The first one, when considering a diagnosis of hypertension, measure blood pressure in both arms. Yeah, the first one, in both arms. If any difference in reading between arms, more than 15 millimeter Hg, repeat the measures. And if the difference in readings between arms remains more than um, 15 um, mmHg on the second measurement, yeah, measure subsequent blood pressure in the arm with the higher reading. Yeah, this is the first information. And the second information, if blood pressure measured in the clinic, yeah, in the clinic is mean when you come, or when the people come to the healthcare facility, yeah, and the blood pressure is 150, and for the diastolic 90 mmHg or higher, so take a second measurement during the consultation. Yeah, so if in the first measure was higher, yeah, it was higher, so please take the second measurement during the consultation. Yeah, not enough for just one measurement. And then if the second measurement is substantially different from the first, take a third measure. Yeah, and then record the lower of the last two measurements as the clinic blood pressure. Okay, and the third information, if clinic blood pressure uh, between 140 and per 90 mmHg, and 180 per 120 mmHg, over ambulatory blood pressure monitoring to confirm the diagnosis of hypertension. And in this information, the detail you can see the NICE guideline. So the ambulatory blood pressure monitoring is the monitoring done by the doctor, yeah, when you come to the healthcare facility, or when people come to the healthcare facility. And then the next information, if ABPM or ambulatory blood pressure monitoring is unsuitable, or the person is unable to tolerate it, yeah, home over home blood pressure monitoring. Yeah, home blood pressure monitoring is mean self monitoring, yeah, by the patients to confirm the diagnosis of hypertension. Yeah, if maybe someone cannot sure, yeah, about the blood pressure when she or he come to the clinic, yeah, we can suggest to do home blood pressure monitoring, yeah, monitor by yourself. But uh, any condition, if you want to take the diagnosis from the home blood pressure measurement, yeah. Let's talk first about if we want to take the diagnosis. If we use the ambulatory blood pressure monitoring, yeah, ensure that at least two measurements per hour are taken during the person's usual waking hours. For example, between 8 and then between 22. Yeah, and then the conclusion will done by the doctor, yeah, will done by the doctor for the ambulatory blood pressure monitoring. Yeah, but take in the during usual waking hours, yeah, and then use average value for at least 14 measurement taken during the person usual waking hours to confirm the diagnosis of hypertension. Okay, when using HbMP to confirm the diagnosis of hypertension, ensure that for each blood pressure recording, two consecutive measurements are taken at least a minute apart and with the person sit, and blood pressure is recorded twice daily, ideally in the morning and the evening, and blood pressure recording continues for at least 4 days, ideally for 7 days. Yeah, discard the measurement taken on the first day, and they use average value of all the remaining measurements to confirm a diagnosis of hypertension. Yeah, this is still information about the diagnosis. Please confirm the diagnosis of hypertension in people with clinic blood pressure, yeah, of 114 per 19 mmHg or higher, and please confirm diagnosis if the person ABMP daytime average or HBPM average of 135 per 85 mmHg or higher. And if hypertension is not diagnosed but there is evidence of target organ damage, please consider carrying out investigation for alternative causes of the target organ damage. Yeah. And then if hypertension is not diagnosed, measure the person clinic blood pressure at least every 5 years subsequently, and consider measuring it more frequently if the person's clinic blood pressure is close to 114 per 90 mmHg. Okay, so when you diagnose, we have to see, yeah, at least maybe in the 7 days, yeah, if you want to use HbMP. Okay, and then if you want to use the, what's the name, ABMP, please take maybe at least 14 measurement, yeah. Okay, next to risk factor, there are some risk factor that can contribute, yeah, that can contribute to occurring in the hypertension. The first one is age. Yeah, for the male, maybe more than 55 years old, and then for the female, maybe 65 years old. Yeah, that's called as the geriatry. Yeah, and then the next risk factor is the diabetes mellitus, because in the diabetes mellitus there's some different condition blood, yeah, because in the diabetes mellitus patient, the blood is consistently more the glucose, yeah, more glucose level, and then from this condition maybe can lead the hypertension. And then the next risk factor is microalbuminuria. This means any albumin in the urine. So if any albumin in the urine, there's some uh, damage condition, yeah, in the kidney. If any damage condition in the kidney, so can lead to hypertension. And then the next risk factor is dyslipidemia, as I mentioned before in the endothelial cell. Yeah, if any dyslipidemia, that's can lead any different condition with the endothelial cell. Yeah, and that can maybe that can affect, yeah, the vasoconstriction. So the next risk factor is family history. Yeah, if someone in the family got hypertension, so the child or maybe the grandson or maybe the granddaughter, yeah, more have more risk, yeah, in the hypertension. And then the next is obesity. Yeah, if any obesity in the people, in the some patient, that can lead the hypertension. Yeah, because the correlation, yeah, the obesity maybe lead the dyslipidemia, and then from the dyslipidemia can lead the hypertension, or the other correlation I will tell you in the complication. So the next risk factor is smoking, yeah, because in the smoke there's some molecule, yeah, can lead the increasing of blood pressure. And then the last risk factor is minimum activity, minimum the physical activity, yeah, from the minimum physical activity can lead the other disease, yeah. So next to the therapy, of course, yeah, the therapy any pharmacologic and non-pharmacologic therapy, yeah. And then before I talk you about the pharmacologic therapy or non-pharmacologic therapy, let's see the goal of therapy. Yeah, the first one, the goal of therapy is prevent morbidity and mortality. Yeah, and then the second one, prevent organ damage. Yeah, for example, like eyes, kidney, brain, heart, and blood vessel, of course. And then if we want to prevent, yeah, we prevent the organ damage, of course, from the goal therapy. Yeah, from another goal therapy is reducing the risk of the risk factor, yeah, reducing the risk of cardiovascular disease. Yeah, actually prevent morbidity, prevent organ damage, or reducing the risk of cardiovascular disease is the further goal therapy. Yeah, or the final goal therapy. For intermediate goal therapy is maintains blood pressure in the normal or target range.